Since the first case was detected in India on the 27th of January, scientists from India and across the world have predicted a grim situation for the world's second most populous country. However, data on the spread of COVID-19 shows that the novel coronavirus has a long history of defying experts' predictions and models. Days after India reported its first COVID-19 case in the southern state of Kerala, experts including mathematicians and epidemiologists started making projections about how devastating will be the impact on the world's second most populous country, especially when countries like Italy and the US were struggling to cope with the deluge of patients. As per one of the projections based on a statistical model, India was expected to witness a steep rise in COVID-19 deaths by mid-May, with a scientific model projecting a grim picture. In the worst-case scenario, mortality was projected to increase to 38,220 by mid-May, while the number of positive cases was predicted to touch nearly 30 lakh, and over 76,000 ICU beds in hospitals will be required to handle the projected load. The scenario, however, is completely different. The doubling rate of cases in India has not hastened, and even more than 3 months after reporting its first case, less than 0.1% of the population has been infected as of the 17th of May. India has reported a little over 90,000 COVID-19 infections and less than 3,000 deaths, which is way better than the predicted numbers. Experts are now saying that going forward, projections of possible COVID-19 scenarios in this country cannot be based on data from Europe and the US. There could be several reasons for India to do well and reduce the number of deaths, as India has a different social structure. Also, the epidemic struck India later than in other countries. Normally, a pandemic has exponential growth at the start, and a small delay can have massive effects on the number of infected cases. India had declared a lockdown when the country had only 500 positive cases, while Italy had done so when it had 9,000 cases, and the UK after 6,700 cases. Researchers have proposed that widespread BCG vaccination for tuberculosis or resistance to malaria have helped India escape the brunt of the pandemic. The reasons for the wrong predictions for India can also be because many scientists are extrapolating from other areas such as Europe and the US, which have not done what India has done to fight the pandemic. European and US models depend a lot on the home for the elderly and the maximum number of deaths that have taken place in the home for aged in the world. Whether it is Italy or the UK or France or anywhere in Europe, many people have died in these old age homes. India too has reportedly high mortality rate among the elderly infected with the virus, but with the majority of the population less than the age of 35, the numbers have not risen the way they have in the West.